Now, the next question. In the ECG, where do you see U wave? U wave is seen if the patient is having hypokalemia, decreased potassium levels. Okay, what is meant by the U wave? So first, you should know what are the waves in ECG. First, you have a wave this is called P wave. What is this called? P wave. Then you have QRS complex. Any positive wave is called R wave, and any negative wave you call it as before R wave is called Q wave. Any negative wave after the R wave is called S wave. Then after that you have a T wave. So after that you have a T wave. This is the T wave. And any wave after the T wave you call U wave. It can be positive wave or a negative wave. Doesn't matter. Any wave happening after the T wave is called U wave. So when do you get this U wave? You get the U wave if the person is having hypokalemia, that is decreased potassium. So you should know a little bit about the potassium serum levels. Serum potassium. What is the normal value? You should be very sure on these terms. 3.5 to 4.5 milliequivalents per liter. Serum sodium. What is the normal value? Commonly asked in exam. 135 to 145 milliequivalents per liter. So any serum potassium level, if it is less than 3, you call it as hypokalemia. Any serum sodium level less than 130, you call hyponatremia. So whenever you have a low potassium, then the patient typically develops certain ECG changes. So you should know what are those ECG changes. So for now, let us learn U wave is a feature of hypokalemia. U wave is a wave that comes after the T wave. Now, let us say you have T wave. After that, you have U wave. Imagine a camel. Imagine a camel. You know how to draw a camel, right? Imagine a camel. This is called, a camel has a hump. There are two humps. What is this sign called? Double hump sign. Double hump. Double camel hump sign. When do you get it? Whenever there is any T wave, following that one more wave which is called U wave, then that is called the double humped camel sign in hypokalemia. So you can remember, this is the QRS complex, and here you have the T wave. In this case, T wave is inverted. T wave is inverted. And after T, any wave is called U wave. U is not a negative wave always. It can be positive wave. So T wave followed by U wave. One more example. This is the T wave and this is the U wave. Where do you get U wave? U wave, you get it in hypokalemia is what you have to remember. So there are various causes for U wave, not only hypokalemia. Hypokalemia is one cause, you remember. When the serum magnesium level is low, you get U wave. When the serum calcium level is low, you get U wave. When the temperature is very low, hypothermia, you get U wave. And if there is any enlarged heart, if the left ventricle is hypertrophic, you get U wave. And certain medicines, digoxin, can lead to U wave after the T wave in the ECG. And any raised intracranial pressure, if the person had a head injury, if there is a raised intracranial inside the skull, if the pressure increased, that also can lead to the U wave. The causes of the U waves is the favorite question of the examiner. Now, With this, we will take a break, and you are learning the concepts and you need to apply those concepts. There are totally 8,000 MCQs in the 14 subjects in nursing: fundamentals of nursing, medical surgical nursing, anatomy, physiology, biochemistry, microbiology, and nursing administration, nursing management, nursing informatics. So all these 14 subjects, slowly we will do a revision. This is a live online class, and every day morning 10 a.m. to 1 p.m. Just log into our YouTube channel. You have a free broadcast, live online interactive broadcast, and it is going to help you a lot to prepare for all the staff nurse exams, international nursing exams like HARD and NCLACS, etc., etc. Good luck, and see you once more tomorrow morning.